Hi everyone, thanks for coming. Today we've had a small number of people test positive in the early hours of this morning. So at the moment, with the outbreak here in Shepparton, we have a total of 21 active cases that are being closely monitored and contacted by our contact tracing team. Acknowledge we've had a high demand for testing during the day, so we're running 3 sites for testing, 2 being drive-through locations at the Shepparton Harness Racing Club and the Shepparton Sports Precinct here at the main hospital campus, where we have a respiratory clinic as well operating. So far today we've done over 1,000 tests for people in the community, which is a great effort, and most of those sites will continue to operate this afternoon into the evening, probably around 5 or 6 o'clock. And those sites again will be open early in the morning, and we'll provide that updated information on our Facebook pages as we confirm the times later today. I acknowledge that there has been some longer queues, and demands for testing has been high today. We expect that it will be high again tomorrow and probably into the early part of next week, and we thank the community for coming forward and coming to be tested as they've been asked to do. It's important that anyone who has been tested stays at home and quarantines until they get their results, and also receive further instruction from contact tracing teams. So we're working as hard as we can. Unfortunately, some of the challenges that we've had to deal with in the recent course of today is that a high number of our staff, like many other people in Shepparton, have close associations with the schools that are listed as exposure sites. So that's had an impact on the number of staff that we're able to dedicate to certain critical activities across our health service, including testing at those locations. We have received support from additional testing teams from Bendigo Health, which is terrific, and also from the rapid response testing team from the Department of Health as well. So we're doing our best to supplement our local resources with additional resources from out of town. There's a number of exposure sites that are now being loaded up onto the Department of Health's website, so we're encouraging people to keep a really close eye on the department's exposure website in terms of all of the sites that we're looking to provide the community with information about later on this afternoon, overnight and in the coming days. We expect there'll probably be a large number of exposure sites that will be published in the next 24 hours. So I'm happy to take any questions.
Do we know any more about where the original case contracted coronavirus from?
No, not at this stage. That's still being investigated by the contact tracing team. We know at the moment that the number of households that are involved is really related to 3 closely associated family groups, and then some extended networks related to that group of people. But it's more than likely, I expect in the coming few days that will broaden in terms of different households throughout the community.
Do you expect that these people have been in the community infectious for some time?
That's still a bit too early to tell, but it's possible that that's been the case, and I guess we're certainly encouraging anyone to come forward for testing that is symptomatic. Probably in the next 1 or 2 days we would open that up a bit more broadly. What we're really concentrating on this afternoon and into tomorrow is the few key locations within those schools at Orvale Primary School, Maguire Secondary College campus, as well as St Mel's, 3 schools in the Shepparton area where we know we have close contacts in those particular grade levels that we've published. And the reason why we're concerned about that is we know that we've had positive cases in those grade levels. So we're encouraging the students and staff and their family members to come forward for testing as a priority, and that's a really important thing in terms of trying to create access for those people at the testing sites this afternoon and into tomorrow.
Do you know how many people are isolating in Shepparton at the moment?
It's going to be in the thousands. So if you consider one of the, say for example, the Maguire campus, I think has around 800 students at that campus. By the time you take into consideration the teachers and the staff at the school, and their household members. You're already, well into the thousands there, and we've got another couple of large schools involved, so it's more than likely in the coming days that we'll have primary close contacts in the order of the thousands, and a high number of secondary close contacts as well.
How much are you expecting the case numbers to potentially grow by? Are we fairly happy that with the rapid testing these might be the worst days?
I think it's probably likely that there will be some more people testing positive in the coming days. The contact tracing team worked really hard yesterday and into the night to identify the people we were concerned about and have them come forward for the rapid testing. That's given us some good information and confirmation, I guess, of what we suspected. And from there, it's a matter of now doing that investigative work that the contact tracing team need to do, but I expect there probably will be some more positive cases in the next 24 to 48 hours.
And in terms of the number of your staff that have been caught up in this outbreak, do you know how many?
At the moment, we think there's at least 100 people that are furloughed, 100 of GV Health staff, and that's having an impact right across our organisation at the moment. In order to do that, to maintain the services that we consider to be essential and critical, we've had to redistribute or redirect people to other parts of our health service, and including the testing locations, so that we can provide the services we need to do at the moment and in the coming few days.
We have there's a big strain on the COVID testing sites. Some people waiting up to 5 hours even at the one beside us. Is there a plan to make more clinics around?
So we are fairly challenged in terms of staffing numbers at the moment. As I mentioned before, we've had a number of people we would usually use in those testing locations have had to be furloughed and now at home quarantining. We've called in additional resources from Melbourne and Bendigo Health to support us. How we plan to manage that into the coming 24 to 48 hours is we really ask people who are caught up in the schools in particular, where we've got high numbers of people, to monitor our Facebook page and the department's exposure site website for the particular grades and year levels that we're going to be calling forward. The reason why that's important is because we want to target the areas where we know we've had confirmed cases of COVID-19 and then be able to run it to ground through that process as quickly as possible. What happens if people come forward for testing that aren't in that area is it just actually slows up that work. So what we'd ask people who aren't involved in those particular grade or year levels to just stay at home and quarantine, just to give us a little bit of time so that we can do the priority testing work to really understand better the number of people that are testing positive and then how widespread this outbreak will travel to.
So for the people at schools that are not in the year levels that need to go and get tested, they're still staying at home and isolating at this stage until they're told to get tested?
That's correct. So people who have been yesterday asked to collect children and stay at home, we'll need them to continue to do that, to remain in quarantine. They will be contacted either directly by the contact tracing team to come forward for testing, but probably the better place where they'll find information more quickly will be on the Department of Health's exposure site website, and we'll also post some information about that as well. But if they can just stay at home, be patient. I appreciate people are concerned and anxious about that, but as I said before, it's really important we focus on the priority areas that we're concerned about so that we can understand better what's occurring in relation to the outbreak.
So what are the days that are the concern?
All of that information, all of the information about the particular days and locations of the exposure sites will be posted on the department's website and the Facebook pages.
The 3 schools you've already have been posted. Is there more information to come relating to those schools? Because they're currently a Saturday all day.
Yeah, so unfortunately there's appears to be an error in the department's website that we've asked for that to be corrected. That's being done right now. My understanding is that all of last week, from last Monday, is the area of concern for those particular year levels and schools at the Maguire campus that we've spoken about.
Has it got to a point where we've had to turn people away from testing sites?
We're not turning people away. We've asked people to come back for testing later on this afternoon at all of the sites, particularly the 2 sites where we've got drive-through testing occurring. And the reason that we've done that is primarily out of safety for everybody that's involved in the testing, because we've seen instances, unfortunately, with the queuing that's occurring due to people presenting for testing, that they've been waiting and blocking roadways and also parking in areas where they perhaps shouldn't park, and that's causing a traffic hazard and a safety concern. So the people that are, the organisations assisting us with the traffic management have provided that advice that it's in everybody's safest interest that we take those steps.
Do you understand in terms of ages of the current cases, of what the range is?
Yes, so there's young people, children, primary school children, secondary school age children, young adults, as have all tested positive so far. So it's it's not. Whereas in wave 2, I guess we had the coronavirus was more prominent in older adults. This is not the case with what we're seeing at the moment, and that reflects the trend across Australia at this stage.
So just to confirm, of the 21 cases, the majority of those are children?
Yes, the majority would be children, but as I said before, they're all confined or associated with 3 family groups.
So,
Good. Thank you. You good, Damon?
Thank you.
so in regards to Marubna, the Unions there were told to isolate, and then it was taken off the site and then put back on. Just confirming they are needing to come forward and get tested today or as soon as possible.
The Marubna campus is a stay-at-home at this stage, is my understanding.
Yep.
But we'll confirm that and post that information later today. But as I said before, the most reliable place that people can access this information. So the way the contact tracing process works, it's not just our GV Health's public health unit that's now picking up the locations of concern. There's other public health units across Victoria, and it's a networked arrangement and a system that works really effectively. There'll be other public health units that will pick up and run with certain exposure sites. All of the public health units then feed that information into a central portal and database that's managed by the department, and then that information's uploaded to the Department of Health's website. So that's the reason why it's absolutely critical that people monitor the Department of Health's exposure site website, because it's really is the single source of truth.
Have we confirmed whether this is the Delta strain in this cluster?
I haven't had that confirmed yet, but I think that based on what we're seeing, the behaviour of this outbreak, how quickly it's moved around, it's probably more than likely that it would be the Delta strain, but we haven't had that confirmed just yet.